Saudi, this is what you wanted. You're going viral, Roman.
Well, it looks like Logan Paul had an awesome match against Roman Reigns in the WWE. Turns out he did not come out with the victory, but really showed that he can be a pro wrestler. His performance was extremely impressive, but unfortunately, it turns out that he may have torn his ACL, his MCL, and meniscus. So we have a article here that says Logan Paul suffered torn ACL, MCL injuries in Roman Reigns match at WWE Crown Jewel. Now, at the time of recording this, that just happened yesterday. So I'm not sure how they knew super fast that he tore his ACL, MCL, unless he got an MRI and the results right away. But we'll talk about maybe some tests in just a bit, but let's hear what Logan has to say himself.
It's light. All I did was tear my ACL, MCL, and potentially my meniscus.
That's nothing. That's nothing. That's
Yeah,
like
we'll
a
be fine. Week max.
maybe 8 days.
Best girlfriend ever. Thanks, babe.
So it looks like he is saying he tore his ACL, MCL already back in the locker room right after the match. Now, it is possible to determine if someone likely tore their ACL and MCL from different maneuvers that are not going to be 100% accurate, but can give you a pretty good indication of whether or not those ligaments are ruptured. But before we get into the maneuvers, I just want to show you what the MCL and ACL actually are. So if you go to our anatomy tool here and I zoom in, I've already highlighted the ACL, which stands for anterior cruciate ligament, and this attaches at the anterior intercondylar area on the tibial plateau. So this is actually the tibia, this is the femur, and then it ascends posterolaterally, so you could see it going up this way and laterally, and it attaches on the lateral condyle of the femur. So if I take a view from the back, you could see it coming all the way up here and attaching on the femur. Now, the MCL, which is right here and is also known as the tibial collateral ligament. And then inferiorly, it attaches first to the anterior band of the semimembranosus muscle, which you can't see here, but then it also continues to attach inferiorly to the medial surface of the tibia, as you could see down here. Lastly, I wanted to show you what the meniscus was, because a lot of people don't actually know what the meniscus is when they say it. So the meniscus is right here, as you can see. This is articular cartilage that sits on top of the tibia and essentially provides cushion to your knee. So when you have a nick in here, that means you tore your meniscus. Now, there are a few different exams that your physician can do to try and assess for the structural stability of the knee. When assessing the ACL, one exam is called the Lockman test, and another exam is called the anterior drawer test. So here's an example of a Lockman test. You could see that the examiner is stabilizing the femur against the table. The knee is flexed in about 25 degrees, and then he's applying an anterior force and seeing the laxity of how much the tibia will move anteriorly. So as you can see in this case, there's definitely anterior translation, and the best way to really assess is to compare it to the non-injured side. Now, there are some studies that show that the Lockman test has a 77% sensitivity and over a 95% specificity, meaning that it doesn't pick it up every single time, but if it does pick it up and you have a positive Lockman test, you most likely have a torn ACL. Another exam is an anterior drawer test, so let's take a look at that now.
The knee is flexed between 60 and 90 degrees with the foot resting on the exam table. The examiner puts both hands behind the tibia and attempts to displace the tibia anteriorly while the foot remains resting on the table. Increased tibial displacement with the foot in neutral indicates a positive test, which is graded by severity. A grade 1 is 5 millimeters, grade 2 is 5 to 10 millimeters, and a grade 3 is greater than 10 millimeters. The test is then repeated with the tibia in 15 degrees of external rotation and in 30 degrees of internal rotation to determine the integrity of the posterior lateral and posterior medial corners.
And again, some studies show that an anterior draw test actually has a pretty low sensitivity, but a very high specificity, upwards of 95%. So if you get a positive anterior draw test, which maybe Logan Paul did in this case, then it's very likely that there's a torn ACL. However, I actually personally tore my ACL and did not get a positive anterior drawer test. That does not mean I didn't tear it. So again, just because you don't have the finding doesn't mean you didn't tear it, but if you have the finding, it's pretty indicative that you did. Logan Paul Paul also said that he believes he tore his MCL. Now, as we showed before, the MCL is on the medial side of the knee, and so providing a valgus force will be able to assess the laxicity or if there's any stability at that area of the knee. So let's take a look at how you can actually assess the MCL without imaging.
Hi, my name is Dr. Brian Schwabe. In today's video, we're going to do the valgus stress test of the knee, which is used to assess the integrity of the MCL. A positive test at 30 degrees of knee flexion would be excessive gapping or pain in the MCL region. However, it should be noted that some gapping is normal at 30 degrees. The next part of the test is the same exact test at 0 degrees of knee flexion or neutral, and any gapping or pain in the MCL region is considered positive. To perform this test, what you're going to do is you're going to place your hand on their knee on the medial joint line. Bring them into approximately 30 degrees of knee flexion. And while palpating the medial joint line, you're going to apply a valgus stress test and a valgus force.
So as you can see, he's putting pressure from the outside.
Next, bring them into 0 degrees of knee flexion or neutral. And again, while palpating that medial joint line, apply a valgus force.
So as you can see in this picture, if you put a force on the outside, the lateral side of the knee, a valgus force, then you will have the possibility of tearing your MCL, your ACL, and also your meniscus, because once you have damage to that area, it's very likely that you have some sort of medial meniscus or other meniscus injury. And we actually call this the unhappy triad, which is very common in sports and is essentially known as blowing out your entire knee. Now, the best way to determine whether or not there's an unhappy triad or a torn ligament in the knee is going to be to get an MRI, which I'm sure Logan Paul is going to get some of the best care. He's going to get that imaging and then discuss treatment options. A lot of times, these will require surgery, especially to get back to a high level of athletic functioning. And for Logan Paul, if he wants to do this, or this, or this, then he's probably going to need surgery. But we'll see what the results show. Logan Paul, wishing you a speedy recovery, awesome performance, and looking forward to seeing you when you're back.